My name is George Gellert. I'm a public health physician and health informaticist, and I'm here presenting 3 presentations on technologies which I feel have a potential populational health impact by improving the ease and use of the EHR, which has been, as you know, our way of manifesting evidence-based medical practice.
Yeah. And where are you based normally?
I'm in San Antonio, Texas, in the U.S.
Super. So making the trek over for obviously a very relevant conversation for this audience here at HIC in 2024. I'd love to learn a little bit more about the content that you're sharing. So you mentioned you've got a few different sessions over the next couple of days. Tell me about that.
Well, the first one up is on mobility, managing a device fleet, a mobile device fleet by hospitals or health systems. And what we find ourselves in is in that very early phase of adoption where I think the clinicians certainly and many of the IT leaders and administrators in hospitals and health systems, they love the concept of device mobility because it puts the clinician back in the patient's room and allows for a much more natural interaction with all the data they need in the EHR or other applications available on a tablet or on a phone. The problem is that we haven't yet really developed sophisticated capabilities to manage a mobile device fleet of potentially thousands of mobile devices. And so what I'm going to be talking about today at the meeting is firstly an international survey across 4 countries, Australia, the United Kingdom, the US, and Germany, about different IT executives in health systems' views of mobility and what their current capabilities are. And what they show is what I describe as the love-hate relationship with mobility at this particular stage, which is everyone realizes this is the way things are going. It's inevitable, and it's actually really great and exciting. But it's getting it done and enabling facilities to do this in a sane way and cut through a lot of the potential problems of managing a large enterprise-owned mobile device. And Improvada is a leading provider of technology that enables that. They have a suite of solutions around mobility that enable IT leaders and staff to manage the mobile device fleet while increasing usability, making the workflow much more natural and expedited from the clinician's point of view, and increasing clinician satisfaction with the overall mobile device user experience. So what we're going to be talking about today is that survey, and then a study we did with Yale University's Yale New Haven Hospital, which is Yale's leading teaching hospital, which implemented this solution from Imprivata, and it completely transformed their mobile device capabilities, enhanced them greatly, and advanced them so that they're delighted with the implementation. And it's made life with mobility not just doable, but actually really advantageous now. It's cut costs, cut loss rates, cut the expense of managing a mobile device fleet, the time, and most importantly, reduced idle time and wasted time for clinicians from down devices.
Yeah, we're long from the days of where a computer on wheels or a workstation on wheels would suffice from a mobile solution within a healthcare system or within a hospital. But, on one hand, I guess you don't want the reason why a clinician or a staff member or anyone will pick up a personal device to use within a setting is because they obviously can't do something with the current infrastructure that they've got within the setting. And that's wonderful to have that initiative and desire to do something on the move. But you obviously, as a health system, want that control and also provide the assurance to the individual that they're not putting patient pictures next to their Christmas photos or anything on their personal device. But yeah, I can only imagine that managing a large fleet of phones floating around a clinic or iPads or mobile devices will be, if you don't have a system around that, that'd be a bit of a struggle.
It's a major headache, and that's what our survey revealed.
Yeah.
Over half of respondents across a range of issues felt ill-prepared, felt that their user experience was not great, were expending considerable IT resources, and having a great deal of idle time, delays, and frustrations for clinicians, who want it now seamlessly. And so in, I think, typical Improvada fashion, this builds upon other capabilities that many hospitals already have, such as one-sign or their single sign-on. And so when you have these different components of the product suite, they have a cumulative or synthetic effect in terms of enhancing productivity, clinical workflows, and user satisfaction, as well as clinical effectiveness. because the more time the clinician has to talk to the patient, hands on the patient, look at lab findings, look at radiological findings, versus tapping on a keyboard or dealing with signing in and signing out a mobile device, that's all time that goes to patient care. And the longer clinicians have for patient care, there's no question, the evidence shows higher quality, better outcomes, improved safety. So this is not just a technological issue. This is a clinical care and clinical quality issue, fundamentally and foundationally. So that's why I love these kinds of technologies. This is what I focus my research on, because at a populational level, indirectly and directly, this can improve or enhance the public population outcomes of any health system or hospital, or at a national level. Yeah, and that's what my studies have shown.
Yeah, really interesting. And I guess, if I think about the amount of different systems and tools and logins and everything that would be required within a health setting to be able to just see a single patient, let alone do a full round, it's you don't need clinicians faffing around on a device logging in multiple times when they could be providing better levels of care. You've touched on that it's something that you've looked at in different countries, and from my experience in conversations around the world, sometimes there's different levels of priority in different parts, and sometimes this is a pervasive issue everywhere. Are we talking, is this a pain that's felt everywhere around the world?
These are unquestionably pain points everywhere. Where the countries also differ substantially, though, is at the level of their health IT maturity. And that makes a big difference. Improvada has been very successful at working at all levels of IT maturity in health systems. But, for example, one of the other papers I'm presenting at this conference is a follow-up to my older study, which was in the U.S., trying to quantify, when you look at all those 20 seconds or 30 seconds that clinicians are not typing on a keyboard and they're just tapping to we'll call tap and go and get into their clinical applications, the EHR, what does that add up to annually across all your clinicians at an enterprise or a facility level? In the U.S., we found that with a 20-second reduction in login time for when I was a CMIO at one of the leading U.S. health systems, we found that it was worth $8.5 million per year across 50 hospitals every year of time that doesn't go back, the funding doesn't go back to your budget. You're not going to cut budget or reduce headcount. But what you've done is you've liberated useless time tapping on a keyboard to time for clinicians to do clinical work and patient care. And so one of the papers that we're presenting today is a follow-on study in 4 countries, in England, Ireland, Scotland, and Wales, in which we quantified at their level of current configuration and sophistication of their IT infrastructure. We found that because they don't have a virtual desktop as we did in the US and the system I was in, all of the configurations are much more time-consuming, and they're actually not viable. And clinicians today in these countries are typically engaging workarounds. These workarounds, of course, undermine cybersecurity. They risk loss of patient information, personal health information. They are really non-compliant with best practices in terms of data management in healthcare. And when we quantified that across these four countries and 70-odd hospitals, it was a staggering amount of funding in terms of liberated clinician time. It was of the order of $56 million a year, which is very, very dramatic. And when we then did an analysis and we said, well, what about all the other hospitals in these countries that are eligible in terms of their IT maturity in their health systems and hospitals? It was over $1 billion in clinician time that, if they were compliant with the best standards and practices of cybersecurity and preserving the confidentiality of patient data, that's what the clinician time would be worth on an annualized basis for about 300 other eligible hospitals across these 4 countries. So, these little 20 seconds here and 30 seconds there, or 10 minutes here, when you add up the number of times that they're going into their EHR, their clinical applications, and they need to be logging in, that they should be doing through a highly secure manner instead of doing workarounds. And you add up, well, what would it take if they were compliant with the existing technology? It comes out to be millions upon millions of dollars. And at a national level, billion plus.
Yeah, I mean, that's super relevant right now in the current climate of making the most out of the funding that's available. So I imagine that's of quite interest to those CTOs and CIOs, particularly here in the region, but globally as well. I'm going to have to attend some of your sessions because we're not going to be able to dive into all the details of it in this conversation here. But if there was a final thought or a kind of round out of those different topics and the work that you've done and the papers you've written, what are you hoping that attendees that are attending HIC or some of your sessions would take away from?
Well, I think overall it's, even though I'm focused as an epidemiologist and on quantifying value in a dollar sense of the time that's freed by Improvada solutions, we need to remember another dimension here, which is in almost every country, we have a real crisis in a physician and other clinician burnout.
Yeah.
And it's very stressful to be a doctor today. More than ever, they have a greater administrative burden. They're spending more time than ever on non-clinical work, related often to financial transactions in the healthcare system, documentation, and so forth. And what I think is very important to always remember, though, about these solutions is even though they deliver this value operationally and institutionally in terms of liberating time of clinicians, it also, when we say it increases their satisfaction with the solutions, that also means it's reducing their EHR and health IT burnout. And with doctors retiring early, moving from clinical positions to non-clinical administrative positions to get away from all of that, we really need to be focused. And this is, I think, very intensely studied now in Canada, in the US, in Europe. How do we reduce overall physician and clinician, nurse as well, burnout, health IT burnout, general burnout? And these solutions also go very far to doing that in terms of interacting with health IT. It makes it a pleasure rather than a burden.